Hey everyone, and welcome to today's Explainer. Today we're shining a massive spotlight on a systemic crisis that's hitting the very backbone of our healthcare system. We're digging into a brand new, highly detailed research report that systematically analyzed the mental health and occupational stress of nurses. Now, just to protect privacy, we won't be naming the specific researchers or the facility, but I can tell you this study was conducted at a major tertiary care hospital in Dhaka. And the findings? Well, they're a total wake-up call for healthcare systems everywhere.
I mean, think about it for a second. When you or someone you love is critically ill, nurses are the ones standing right there at the bedside. They're literally the front line. But who looks after the people keeping a major, high-pressure tertiary care hospital running day and night? When the system is just stretched to its absolute limits, what actually happens to the minds and bodies of the folks holding the whole thing together?
Okay, let's dive into this. Here's a quick roadmap of what we're going to cover today. The 83% reality, the hidden trauma of care, the power of leadership, and finally, we'll wrap up with the path forward. Starting off with Section 1, the 83% reality. All right, here is the massive, undeniable finding right out of the gate. 83% of the nurses surveyed at this major hospital are experiencing moderate to high occupational stress. That's more than 4 out of every 5 nurses on the floor. It totally shatters this idea that severe stress is just, an occasional bad day at work. No, this is a systemic baseline. Let's actually break that data down a bit. Only 17% of nurses reported low stress, while almost 10% are sitting at a critical, high stress level. But you really have to look at that middle chunk. 73.3% are functioning under moderate stress. And in the medical field, prolonged moderate stress is a seriously dangerous plateau. Left unaddressed, it's a known precursor to clinical burnout, depression, and people just leaving the profession altogether. Almost nobody escapes this strain. To put those percentages into perspective, just look at what they're dealing with physically. The study found the average patient-to-nurse ratio was 63:1. These nurses are routinely managing over 60 patients at once in resource-constrained wards. That is just so far beyond what international safety benchmarks recommend. It's wild. You aren't just managing tasks at that point. You're literally managing over 60 human lives on a single rotating shift. Moving right along to Section 2, hidden trauma of care. So we kind of need to redefine what workplace trauma actually means for a nurse. It's the direct and sustained exposure to human suffering. It's navigating critical care situations where lives literally hang in the balance, combined with the grueling physical demands of shift-based schedules. And disturbingly enough, it's the regular exposure to workplace violence. And this breakdown brilliantly illustrates how these stressors just stack up independently, day after day. Over 64% of nurses reported facing verbal abuse. More than half, 55.2%, had witnessed a patient death in just the last 6 months alone. And a full quarter of the nursing staff reported exposure to severe traumatic workplace events. It's heavy stuff. But get this, because this is a super surprising and honestly distressing fact from the data. Nearly 16% of nurses had been threatened with legal or disciplinary action by patients or their relatives in the past 6 months. In an environment where professional liability frameworks are often kind of blurry, this kind of threat mixes professional humiliation, financial fear, and a complete loss of personal safety. It's a uniquely terrifying burden to carry. So what does this all mean? Well, when researchers ran their multivariable analysis to find the independent predictors of stress, the impact of these events was crystal clear. Nurses exposed to these hidden traumatic workplace events have over 6 times higher odds of developing moderate or high stress compared to their peers. It's an absolutely massive independent driver of psychological strain.
All right, on to Section 3, the power of leadership.
If there are any hospital administrators or nursing managers watching this, you really need to hear this statistic. The analysis revealed that a lack of supervisor support increases the odds of a nurse experiencing high stress by a staggering 30 times. Let me just repeat that because it's huge. 30 times higher odds of severe stress simply based on the presence or absence of leadership support. Wow. Now, what's really interesting here is the sheer contrast. When you compare a nurse who is always supported by their supervisor to one who is never supported, leadership's true impact becomes undeniably obvious. In a high-pressure, resource-constrained hospital, a supervisor isn't just a boss. They are the ultimate psychological buffer between a functioning nurse and total collapse. The researchers put it perfectly in the report. They wrote, "The supervisory relationship may be the primary channel through which institutional care for nurse well-being is expressed."
Basically, when formal mental health programs are missing, regular leadership check-ins, just acknowledging workload pressures, and simple human support are quite literally saving these nurses' mental health. To sum up the core multivariable findings, we clearly see the undeniable primacy of leadership. Poor supervisor support is that massive 30 times multiplier. Workplace trauma comes in as a 6.27 times multiplier, and poor self-rated health is a 3.13 times multiplier. Those are the three strongest, independent predictors of whether a nurse is going to hit that dangerous, moderate to high stress threshold.
Let's move to section 4 and see how this all builds into the path forward.
So, how do we fix this? The study outlines what's essentially a mandatory prescription for change. First, hospitals absolutely must implement structured supervisor check-ins. I mean, we just saw the 30x multiplier, so this is non-negotiable. Second, they need to provide stigma-free, easily accessible mental health care. Third, establish proper trauma debriefing protocols for after patient deaths or violent incidents. And finally, systematically address and improve those crazy nurse-to-patient staffing ratios.
Because right now, the gap between what is needed and what actually exists is massive. Only 16.3% of the nurses surveyed even reported that mental health services were available at their workplace. Nearly 69% said absolutely none existed. Look, if we're asking nurses to manage 60-plus patients, witness severe trauma, and face daily abuse, institutional support cannot just be an afterthought. It has to be a structural foundation.
So the absolute crucial takeaway from this explainer is that the stress facing our nursing workforce is measurable, it's severe, and it's largely driven by structural factors and leadership gaps that we can actually fix right now. Which leaves us with one lingering, kind of provocative question for stakeholders everywhere. What happens to a healthcare system when its backbone finally breaks? The time to implement these changes isn't tomorrow, it's today. Thank you so much for joining me on this explainer, and keep learning.